Welcome to Deep Pockets by Petra Söderling, a conversation about governments, technologies, and innovation. The ongoing season, Winter 2023, is loosely based on my upcoming book, Governments and Innovation, The Economic Developer's Guide to Our Future. The book will be available for purchase in Amazon during Q1 2023. Our theme song is by New Orleans jazz icon Leroy Jones. It's my pleasure to welcome you all back to Deep Pockets, this week to an episode that should concern everyone. That's our health. We're all interested in our own health, or at least I hope you are. But as taxpayers and voters, we should also be interested in the health of our fellow citizens. The coworkers, teachers, bus drivers, our CEOs, every one of us who keep our societies going needs their health. What's the innovation in health, and what is government's role in that innovation? To unpack this, I've invited someone who has a distinguished career in asking and possibly answering these very same questions. Charlie Schick has a Ph.D. in molecular biology from the University of Massachusetts Amherst, a Bachelor of Science in Biology from Boston College, and has worked for technology companies like OWL Cyber Defense, IBM, and Nokia. Welcome to Deep Pockets, Charlie.
Thanks, Petra. Great to be here.
You've looked at healthcare and health tech from different angles over the years. Can you expand on my short intro there? How did you get into this topic, the intersection of health and technology?
Well, so that's always a good question. I always wanted to be a scientist. I could remember all the way back to when I was 7. And my folks were really supportive. They surrounded me with books and toys that are related to science. For me, biology was my strength. It came naturally to me. And so I did the standard path through science, where I did science in college, I did grad school, I did a postdoc, and then I even rose to an instructor level position at Children's Boston. And instructor level it's like a junior faculty, and that was part of the Harvard Medical School. So my last lab role was really about characterizing these interesting molecules that were associated with cancer, skin cancer, and they were related to a whole class of other important inhibitors of enzymes. And so we did genetics, biochemistry, molecular biology. We were making antibodies, analytical tools, and all sorts of really fun, geeky stuff. But my dad, he was a finance guy. And so the finance folks were the folks who actually were using computers in the 60s and 70s. And so through him, I was exposed to the whole world of computers, of telecom, and the greater high-tech world. So it was no surprise to me when I left the lab. I left to be more of a web head, a tech analyst. This was a time when the web was booming, and that kind of vaulted me into a long stint at Nokia, where we met. And at Nokia, the teams that I was on was always some sort of team that was like a cutting-edge team. We're trying to do new stuff, disrupt things, including the one that we were on. And it was really great because I got to meet like all these tech leaders and hanging out with fellow thinkers who were like inventing things, trying to do something new. You know, it was about the mobile internet. And really having a blast. But after a while, I kind of wanted to do something else. I was trying to get back. I was hankering to get back into biology, get back into healthcare and science. So I left Nokia. I came back to the Boston area. Mm-hmm. And here, Boston is really big in healthcare and life sciences. So I really felt comfortable coming back here. But I knew that I'd been out of the lab so long that I wouldn't be going back to the lab, no matter how much I missed it. And so I wanted to fuse like what I'd done in what I learned at Nokia, all that tech side of things, and then fuse it with what I knew in healthcare and life sciences.
But you were also at IBM at some point.
Yes. And so when I left Nokia, I went into IBM, and there was also like a great experience as well. And there we were very similar to the role that I have now, where we were industry advisors, helping companies identify opportunities, understand the strategies, what are the products they should use, and help them grow in healthcare and life sciences. And most of that was data-driven application, digital health, cybersecurity, and a little bit of product design. And so I was able to bring that together, and it's always really great. I mean, yesterday I was at an event, and it was a bunch of PhDs, but they were all in life sciences, and they were making products, and they were doing drugs and stuff like that. And it's so great when you can apply something that you know and help people do better, right? So that's what gets me going, like really helping people grow their businesses. And in the past 6 months, I've been at Business Finland, and there I'm helping U.S. companies, healthcare and life sciences companies, helping accelerate their research through business opportunities in Finland. So I've kept that thread since my Nokia days.
It's so funny. Your dad, who was not a computer scientist, brought you into computers. That's exactly what happened to me. My dad's an architect, but he was, he bought his first IBM computer in the mid 1980s, and he forced me to do my homework with it. So I had to learn BASIC, when I was, 16, 17 years old, because he wouldn't let me do my homework with any other way. So I can relate there.
Good man.
Yeah, he's a very good man. So what's new? What's new and exciting technology-wise in health? And I'm including pharma, insurance companies, everything in there. Anything that you see important, incremental, or even disruptive.
Yeah, on the healthcare side. So, the healthcare side is like hospitals and providers, who provide healthcare, and payers who are like insurance companies. And then the life sciences side, those are like the pharma, the medical device companies, the biotechs, right? So, on the healthcare side, what's been really interesting is not so much like on the technology front, but a lot of what's changing within the market itself. There's been incredible muddling of who does what. So payers and pharmacies are getting into primary care. Pharmacies and providers are getting into insurance. Big tech like Amazon, Apple, Google, they've been dabbling with everything along that value chain. But what's really going to drive a lot of the success that everybody's been talking about for the last 10 years is data, right? And being able to mix data to improve outcomes, to improve patient care, to improve satisfaction, to lower costs. And back in the day when I started in this space, we just call it advanced analytics, but it's safe to say that what we were doing was AI, making sense out of huge amounts of data, applying models to them, and optimizing for a desired outcome. And I think that's where a lot is going to happen in making those things better. Like, how do we make that better? On the flip side of that, we're really also improving how we collect data on patients, because over the last 20 years, we've been in the US, we've been digitizing records, we've been getting better at monitoring patients. And definitely in the past 5 years, there's a whole group of people who are called quantified selfers. And these are people who measure themselves to understand their own performance, their body performance, their health. But that's gone mainstream. And you get Fitbits and Apple Watches and Samsung Watches and all that stuff and all these smart gadgets.
Biohackers.
Do you have a smart scale?
Oh, yeah. No, not a smart scale, but I have a Fitbit.
A Fitbit, yeah. And so if you take that and realize that we're having all this explosion of data around what it is to be human, right? How we live, how we breathe, how we move, how does that help us do better care, right? And in one area is this area of remote patient monitoring that I've noticed that people are talking a lot more. And we kind of always did that. The folks who had pacemakers and defibrillators, they always had some sort of machine at home that would send the data back to the doctor or the manufacturer. But now the expectations of who owns what data, what's it for, what do we want out of our own health data is really changing that discussion. And I think this whole area around remote patient monitoring is really just the tip of an iceberg of this whole, we're going to be surveilled. Our bodies are going to be surveilled, and we're going to be able to get immense data out of that. And the hard part is, what's useful, what's going to help. And I don't know if we're going to be even necessarily have to be better than a good nurse or a good doctor, but how do we help them, what we say, practice at the top of their license, right? How do we use this data and this AI to make these people better people as tools? So, but we were talking before, as always you do in these things, and one of the areas that I am not too keen on around the technologies that we're using in healthcare is a lot of folks are trying to do, especially when Alexa became big, everybody's like, oh, we're going to do a voice interface for elderly people. Now, if you've ever watched someone over 70 trying to talk to Alexa, then you realize like the voice interface is probably not right. And
there's an SNL sketch about that.
Absolutely. That was phenomenal. I showed it to my mother because my mother has an Alexa, and of course it's a battle. And she just was laughing at that. But that's how it is. I mean, it's nothing against, one thing I learned dealing with the elderly, because my parents are older and have had to deal with a lot of their healthcare. I am the one who helps them with their healthcare. That we think of how we are and what we do, and not realizing that after a certain point, it's different what they expect, what they want, what they're willing to do. And not that they can't learn, because my mom texts me all the time. She's really technically able. But certain things are not part of how they interact with technologies. And so it might be hard to get them to use it. So I think, touch interfaces and voice interfaces are damn cool, but not for seniors. Not for seniors. And a lot of remote monitoring tools that are purchased for seniors are not really serving the senior. They're serving the surveiller, the child or the doctor. And it's really becomes like a panopticon around this elderly person. And it's actually not fair to them, right? And I think we're not meeting them at their level. We're meeting them at what we expect them to want. So anyway, that's the backside of that. Maybe I should have talked bad about stuff. But AI is a big thing.
Yeah. Yeah. Okay. That's actually, so the next topic, I was going to go back to biology, genomics. You have degrees in biology. So genomics is the use of human genomes for research. There is something called the Human Genome Project, which started in 1990. It was completed in 2003. What it was an international scientific research project with the goal of determining the base pairs that make up human DNA and identifying, mapping, and sequencing all of the genes of that human genome. That project, if I did my research correctly, opened the floodgates on genome research in different countries. I happen to know a good example here that we both are familiar with. That's the Finnish genomics project, FinGen. Tell us what it is, and I guess also, this sounds a little sci-fi-ish, dangerous-ish. I'm Finnish, so does some mad scientist hold my DNA in a jar somewhere in Helsinki?
Some very good scientists hold your DNA in a jar somewhere, perhaps. I think, it's a good thread that you have, talking about the Genome Project. And to show my age, I left the lab before the first complete genomes were announced. But even back then, we were doing some genetics. Part of the reason I got into the lab was studying some genetics, and the person I worked for did a lot of work that contributed to the technologies that we used for mapping genomes. And back then, we knew the promise of what would happen with a lot of genetic information if we knew more about what was in the DNA. The Genome Project was a few $1 billion and sequenced one person's DNA. Nowadays, you can sequence a genome much more cheaply. But we knew that, if we could know more about someone's genetics, we could target therapies to them. Because if you think of traditional drugs, they're made for a population. And so they might be 100% effective on 80% of the population. So 20%, it's zero effect. But what if we could make it 100% effective to 100% of the population? And indeed, nowadays we do have that. A lot of new cancer therapies only work within a specific genetic background. So they'll test the person and say, oh, you have this genetic background, use this drug. And that's been amazing in the field of cancer. So my first connection with genetics in Finland was I took a clinical genetics course back in the 90s. And the reason everybody was looking at Finland at the time was that Finland, small population, good genealogical records. They were isolated enough to have enriched certain gene variants in diseases. And so back then, pre-genome, that made it easier to study genetics. And if we fast forward to today, Finland is definitely at the forefront of clinical genetics, right? So you mentioned the FinGen project, which, as a disclaimer, was partly funded by Business Finland, my organization. And what they've done, they've characterized the genetics in over 500,000 samples. And there's been a really great collection of publications in Nature. And Nature is a really prestigious journal, science journal, where they show all these different ways that they've discovered interesting things out of the genetic population of Finland. But to talk about the FinGen project, it's not really about just the genetic data. So the real value also comes in when you start combining medical records and disease registries. Registries are ways to collect information on certain diseases like cancer or diabetes. And in Finland, they have a lot of records and registries going back to the digitized, going back to the 60s and 70s. So now what can happen is you pull all that data together and you really get a good view. And not only that, that data helps you understand folks who haven't been sequenced yet, because you can impute what is going on in other people. And so we have this large collection of data, and FinGen really makes it easy for companies to come in and really identify targets, accelerate their research into disease conditions. But FinGen's a piece of an even larger puzzle that's happening in Finland. FinGen, in Finland, we have a bunch of biorepositories where we're collecting tissue samples, other types of DNA samples, and we're aggregating that stuff through different biobanks. We're aggregating all that through the Finnish biobank, FinBB. And so now in Finland, you can actually, find the data that you need. That's a mixture of medical records and pharmacy records and registries and genomic data to really get a good view of what's going on in the population, in the people. And in some cases, you can actually call people back if they're still alive to get more data off of them. And so that's a really helpful for companies to do their research. Now, the real key thing, because here in the US, it's a little bit more fragmented. You have data sets that you have to chase down. But really what makes special the FinGen project and the FinBB is that the government and society in Finland also are part of this. So it's not sufficient just to create all this data. You also have to have the legislation behind it. You have to have the support of the society. Like you were saying, hey, is this, bioscary, right? Does somebody have mine? Well, it turns out that the Finns who are back in Finland, right, they have great confidence in science. They have a big willingness to help with health technology innovations. And so there's a lot of participation, not many people opted out of having their data available for use for research. And the Finns themselves, they can access their medical records. They can know what's going on. They can opt out of things if they want to. But the government itself, from the top level, this is key to what the government wants to do. And so what we call the secondary use of the data. So primary use is for the care of the people. The secondary use is for research is very different than what you find here in the US. And so Finland created a law related to the secondary use of health data. And that literally is made to enable companies to access and utilize this data for developing innovations. And lots of times it's also involved with the hospitals and other research institutions in Finland. And this is a unique law. And what was interesting to me, I was there in Finland just now in January. And what I realized is that they're actually going through a revision of the law, realizing that after a few years that, it's good, but now we know how we can make it better. And so it's an active thing that the government's trying to do to actually drive research by participating in it. So what I call the Finnish model here of using genomics for research is really a mix of the research institutions doing these projects like FinGen and the medical systems doing that, the government with the laws, and primarily the people who are yes, let's do this. And so the question for me is always how do we get other countries to learn about this? And I think, the EU is now getting ready to make laws around this, and they're looking towards Finland. The US, we're involved in the Personalized Medicine Coalition. They're very big on policies on how to make it easier for people to use this data for exactly this. And Finland really has that cool model. So I hope that answers your question a little bit there.
It certainly does, and it fits the topic of our Deep Pockets podcast precisely. Let's expand on the role of the government. Talk us more about the relationship between public and private actors here. As an example, taxpayers have contributed to the development of vaccines and other drugs, but they still have to pay expensive prices at the cash register, and corporates take all the profits. So do you have an opinion on this model where taxpayers are paying for something that benefits the corporates, but then at the end doesn't benefit them directly? Probably some improvements needed, but in the model, in general, do you agree with this model?
Yeah, so it's not so much that I have an opinion, but I actually have questions for folks who question it. Because when I was a graduate student, when I was a postdoc, when I was a graduate student, some of my money was coming from the federal government. And these were through grants, these are through awards that I got. And the government has always funded basic research. But the goal for funding basic research is to drive innovation and to build new products. And somebody's got to commercialize that. So governments have always funded things that ended up going into profit. And you talk about vaccines, and more recently, so there's been a little brouhaha forming around Moderna and Pfizer, who have decided to finally raise the prices of their COVID vaccines. And people are saying, hey, wait a minute, we gave you billions of dollars. We gave you billions of dollars to accelerate the development of that. We gave you billions of dollars in buying it, right? So why do we have to pay more for the vaccines? So the question is, at what point can the government keep asking for a special dispensation because they funded the research? Because in actuality, so much has been funded by the government, right? And I think in previous podcasts of yours, you do mention things like the internet, right? That was all out of government funded stuff. And so there is a role in it. And I think, the government allows things to happen that would have never been commercially viable for a while. I mean, the Genome Project would have never happened if it were a company. Though, to be fair, there was a company who competed with it, but that's when the technology was starting to get more mature. But at the beginning, it was all a lot of public money. So the question is how long? How long? They want to raise the prices. Does the government still keep them in check, even though they raised? They help them. I don't know. I don't know where. Is it a case-by-case basis? Why specifically these vaccines? I don't know. So, I mean, it's not so much that I have an opinion about it. I think the government definitely has a role for accelerating research. I mean, I think it's vital. I know of one organization where they usually have their exploratory research funded by the government, and then they license it off to a company, and then the company commercializes it. So they're able to do both sides of it. But yeah, I mean, companies, they get SBIRs, they get, there's those small business innovation grants. That happens everywhere. And the government has to do that because I think it's not going to happen commercially. And it allows the government to, I mean, nowadays, these new acts that Biden came out with are more dirigisme, industry policy, where they're picking directions, but kind of way we did that all the time, the space race and, stuff around computers and DARPA, we do select at some level. Governments do select at some level where they want the research to go. I mean, we do that at Business Finland. We build programs to promote certain paths, like FinGen is a program that we, for us to promote. We gave a lot of money for that. That's us selecting some. So it does happen. It's not bad. But I just think, the real question for me is at what point do we just let these companies make their money, right?
Good answer. Thanks. I have another tough question for you. I know this is maybe a bit unfair, but I'm going to ask the question Anyway, you speak at least 5 languages, and you've lived, I don't know how many countries, maybe at least in 5 countries. So you've seen all kinds of governance models for people's healthcare. There's the universal healthcare that's completely funded by taxpayers. It's in use in the UK, France, and Finland. Here in the US, we pay insurance companies who in turn pay the hospitals and the drug manufacturers. And then some countries have some form of combinations. I know Switzerland, maybe Australia. So give us your thoughts on these different models.
Yes, this is what I read a great article in The Economist once that kind of broke down how to think of this, because we in the US love to say, oh, the Canadian model, right? I think we don't realize both sides, EU and in North America, it's a mess. And if you break it down, in the way I break it down is this. So in the US, we have private paid and private run. So those are the ones that you usually get through businesses. You're paying, the business is paying, and you go to a private doctor. But that kind of locks people to jobs. And there's a history about why we have it that way in the US. Then we have the public paid and the private run. And so that's Medicare. So people over 65, they get private care, but it's paid by the government. And the government negotiates with private companies how much they can charge, right? And also, with these private paid, private run, the insurance companies negotiate with the providers of care how much they can pay. So keep that in mind. And then finally, the US also has public paid and public run, and that's the VA. So the VA is for the veterans. They don't pay anything, or they pay maybe like costs, copays. But the hospitals are all run by the VA, and the hospital, the people who work at the hospital work for the government, right? So we have a mix there, right? And if you look at Finland, Finland is typically public paid, public run. So the hospitals and the doctors belong to the government, and the government pays for it. You pay through your taxes. And one little secret is, when I moved back to the US, the amount of money I was paying in taxes and healthcare was the same that I was paying a percentage in Finland. So I wasn't paying more taxes. I still paid for it in the end, even though the difference was I was paying my healthcare to a private company rather than the government. But in the end, the percentage was still the same as what I was paying in Finland. So that's a fallacy that people have as well. But Americans look at this public paid, public run as socialized medicine. And I think in Germany, I think it's public paid, private run or something like that. But what's interesting for me with Finland in the past 10 years, I've noticed that private pay, private run is on the rise, right? I was surprised at how many clinics now are there that are private clinics. Before, I was a hard time to find them when I lived there. I don't know but it just seems more in your face now. And back in my day, as I remember it, private care was usually for specialist care. Like if you go see an orthopedics, I'd go to the private one, right? And you would pay a rider on top of you'd pay like a little insurance and all that. And in Finland, you also have a little bit of the private care provided by the employers, which happens in Finland, because I remember going to the clinic in our Nokia house to see someone. And so it's very interesting that private care is growing. And what's going through my head is like, how does that change how care is provided in Finland, and who pays for what? And I need to myself investigate more what's happening in the whole private care aspect of it, because now private care in Finland looks like they're going to primary care. Right? People take their kids there because it's faster or something like that, right? So the people could pay. But and does that cause a division, very unfinished division between the people who have money are getting better care versus the people who can't have the private care? So anyway, but all these models are kind of supposed to be responding to market needs, right? But there's a lot of fragmentation here in the U.S., how care is provided, how it's paid. You have regionalism and stuff like that, and hospitals coming together. And the only people who really know what's going on are the payers, I think. And then the other thing that's really difficult in the U.S., and less so probably in Europe, but there's no price transparency, right? And pricing of things is confusing to everybody, even if you know what's going on. So folks get like weirdly itemized bills and things are pricing, and sometimes they get surprised that it's not covered, and then they got to pay it out of pocket. And the classic one is you get you do a procedure in a hospital, you get the anesthesiologist bill, you get the hospital bill, and then you get the doctor bill. It's like, what the heck is going on, right? And then one area that's really makes it really hard in this space is the whole area around drug pricing, because we think that the pharma are the ones setting the prices, but there's actually a middle group in between, the pharma benefits managers. And these are like CVS and Walgreens, who are actually buying the drugs and distributing them. And those folks, they also mess with the price and set prices and things like that. And so how are we going to, so folks like Amazon, they're trying to break that. They're trying to break this whole weird way of things coming together. And, I was like, you made me think of this question. And when I'm pessimistic, I feel that the whole system is designed to be inefficient here in the US, and that the money is being made in that whole confusion. But I'm normally an optimist. And so when I'm optimist, I get very excited seeing that there's always plenty of work to be done to make things better.
Let's try to leave on a more positive note. So this is my final question. What is exciting in the next few years? Leave us in awe with something that regular people like me would not be aware of.
I think the whole area of AI and advanced analytics is for me, I remember having first discussions with hospitals maybe 10 years ago saying, hey, we can predict when a kid's going to get sick. And they were like, wow, that's like crazy. Oh, that's too much. Now, if I were to go to a hospital and say that, they're like, okay, show me how, right? So things have really improved over time. And for me, it's not about replacing doctors and nurses, which I don't think we should ever do, but it's how do we use this as a tool for them to see more and do more and be better, like, or take away things from them that they don't need to do. And one of the stories I like to share is I have a colleague whose daughter, she went home, and then at home she almost died because they found out she had a heart condition. And the heart condition could have been caught if they had just done a little test that they now do but normally didn't do back then, to just check her oxygen level at 2 days. And if it's not right, do an ultrasound. Now, the real problem is not so much doing a pulse ox, which everybody has at home probably these days, but the ultrasound requires skill. And so she said, how do we put the intelligence of an ultrasound person in the machine? Because what the real problem is, newborn kids are transported a lot. And if the kid's born in some, in the middle of nowhere where it's a third level hospital, a very simple clinic, they don't have anybody who knows how to use the ultrasound. And so how do we avoid that kid having to be transported to a bigger hospital just so that they get an ultrasound by someone more skilled? How can we have someone do that ultrasound still in that clinic? And so how could something like AI look at the ultrasound and say, okay, I think this is, I have a confidence level that this kid's okay, or I have a confidence level that this kid needs to be sent to a doctor, right? And I think that's the kind of thing that we're getting to. And even like, there's a lot of things that we do in the hospital that we might not have to do in the hospital anymore if we do better in terms of, building models around it and really understanding it. And then an aspect that's tied to that is this whole, what I was talking about, remote patient monitoring, is that, we're having miniaturization of sensors and they're spreading all over the place. And you even have sensors that can they're just like wireless sensors that can sense your breathing and your heart rate and where you are and your position and how your gait is. We're getting so much better at collecting so much data. How are we going to pull that together and make that sense out of that? One area that has come up definitely in the last 6 months, a lot of times because I'm dealing now in Finland, and Finland is really kicking this up, is the whole area around quantum computing. I think where folks have done interesting things with parallel computing, using DNA to solve equations and stuff like that. And quantum has that same idea of entanglement and doing things in parallel. I don't know where it fits yet. I really haven't closely followed it, how it applies to, let's say, life sciences research. Will we be able to find drugs faster? Will we be able to, provide care faster? I don't know. But clearly, I think things have picked up in the last year. And I think people have been, you had a great podcast on that guy on quantum. That was awesome. But yeah, I just think it's people are interested in it now. We've gotten to the point where it's okay, let's explore this. In 2 months, there's going to be a quantum conference here in Boston, and there's going to be a whole track for life sciences, right? Because we're a life sciences company, region. So I don't know, but that to me is what's getting me going. But I have a question for you, and I don't know if it's fair. When you look at healthcare and life sciences, what are the things that you're wow, that's cool, but also what are the things you're kind of like you mentioned on the DNA side of things, what is the things whoa, slow down? I'm just curious about your perspective of what you see in the healthcare market.
Well, yeah, you totally caught me off guard here. There's nothing that I'm that's scary or, hold off. I just would like for governments to be more aware and for governments to follow more closely what the industry is doing, not just in healthcare, but in, AI and quantum and any deep science or deep technology that's going to impact our lives and disrupt anything that we do. EU is trying very hard to be on top of everything. Some other countries or other regions, maybe not so much. So I would encourage more conversation between the governments and the industry.
Mm-hmm. Mm-hmm. Yeah, the FDA is. I've been fortunate to meet people from the FDA in these kinds of innovation discussions, and they're always trying to get ahead of things. And lots of times, a new technology would come in, say AI or digital health, right, or digital therapeutics, and the laws that we have really don't support them or make it clear. And the FDA will get ahead of that and say, synthetic biology was another one that they focus on. They have a way of making recommendations, bringing it up, having it explored, figuring out how the rules apply. I know they're coming out with stuff around AI soon. Same thing in EU and in Finland. So there is that, they are watching, right? They are watching at some level. And they do know that someday a new technology is going to come in and is going to screw everything up, right? So case in point for AI and FDA. I was talking to someone yesterday about using AI in manufacturing. Now, when you manufacture drugs, you basically say, you write down exactly how you do it, and you have to do it exactly like that every time. If you deviate from that, the FDA, sends up warning flags and like, why'd you do that? Is this because they want to make sure that you've made the drug the same way every time and you're not messing with things. But when you start adding AI to that, the AI might want to tweak things, or the AI might want to change things. And how do we not upend this whole system, but yet take the advantage of AI to like optimize things and make things better or keep an eye on things? So we do have automation, but even then, how do we do it? Now this is like beyond automation, right? Adding some smarts to it. And so, I think you're right. I mean, you need to keep an eye on this and understand how it impacts people, but also, and it goes to your theme, right? The government has a role in making sure that, if you think of what's the government's role, right? The government's role, let's say in healthcare, is to make everybody healthy. And, it can't be just about like locking down the data for privacy or competing against the Chinese. It's got to be about like, what do we want to achieve? How do we get there as a nation? And how do we pull together all these like private concerns? Finland is about the size of Massachusetts in terms of population, right? It's like Massachusetts, I think, is like 7 million. Finland's 5.5, almost 6 million. I'll give it the generous extra half. It's easier for, one state maybe to do something, but for like 350 million people in the US and to bring that all together and that's a different thing. But we can learn from like what Finland's done to like keep an eye, at least on like the genomic side of things, in other areas. So, I think you're right. We got to keep an eye on it and nudge people in the right direction, focus on the good things, not on the bad things, encourage the good things, discourage the bad things. But government does have a role in that. And people like to, anyway, I'm going off on, everybody likes to push the government away, but not realizing the government does have a role that could be very helpful. From a top-down kind of perspective.
That's a great way to end this. This was so insightful, so inspiring, Charlie Schick. I'm closing off with a quote that I found on your LinkedIn profile. Awakening a sense of fearsome wonder in the ordinary, crafting bits, atoms, narratives in a physical, digital, sublime world. Thank you for visiting Deep Pockets, Charlie.
Thank you, Petra, for a very stimulating conversation.
You've listened to Deep Pockets by Petra Söderling. To subscribe to content and to pre-order the book Governments and Innovation, The Economic Developer's Guide to Our Future, please go to petrasoderling.com. The wonderful music you heard is by Leroy Jones, an iconic New Orleans Jazz Hall of Fame trumpetist. You can find this and other Leroy Jones tunes at your favorite online or offline music store. Thanks for listening, and be sure to subscribe, like, rate, and share our episodes. It means a lot to me. Thank you.